So if anyone gets hurt because of this particular videos, it's their responsibility. They have done something wrong in the past. That's the reason why the video has been live about them. If you wouldn't have done anything wrong, we would not have been in first place making video about it. Okay, so this is purely a physical therapy awareness for students and practitioners. Reason why? Because you don't have any rules and regulations in India. So someone needs to stand against all this scam which is happening. We are going to talk, you must have heard it in the title itself. Introduction to therapeutic taping. Okay, so now all this CPD workshop which are hosted in India does not have any rules and regulation. Let me clarify everything. Council doesn't have rules. No other authorized body have any rules regarding this. Organizers, a person who organizes this particular any courses, are equally responsible if the instructor teaches any wrong stuff. Instructor plus organizer, because organizers are the one who makes posters, who influence students to come to their workshop by giving such incentives like the group discount available. This is one of the tactics to attract students. So if you're learning wrong and if you're going to apply that same knowledge onto the patient, and if that is wrong, that is going to create more endangerment to your future education as well as public health. This was a poster which is just now going to be held in Mumbai, and I told you, being an anti-quackery member for the Thane team, it's my responsibility that I need to make you aware about what kind of, and today you're going to learn in this 30-minute session what exactly is the therapeutic taping, which is modified by this instructor. Okay, this is the public health Bandra submission of the written complaint against the organizer as well as instructor, which was posted on 9th of February 2021 when we had a discussion. Okay, they have one session of discussion with me regarding this matter. I have given all the points listed out why this workshop is not authenticated. I may not show you this, but now forget about the certification. It's the knowledge of the instructor, or it's the knowledge of the mentor who teaches to you in 2 days. Now, in 2008, KTAI was the first one to come to India, Kinesio Taping Association International. I used to organize that particular workshop for literally 3 to 4 years. Out of that, all foreign instructor used to come and teach the taping technique from K-Active Germany. What these Indian people did was, the instructor is from Germany and you are writing credentials underneath your name as Germany. So you are sitting in Chennai, Mumbai, Delhi. Instructor is a German. You can't simply write underneath your credential Germany. That itself gives you an authority that you're claiming it to be wrong and fooling young innocent student by that particular stuff. Now if I show you his earlier poster, this is what the taping specialization is. This is a poster which you will easily see that this person has done taping from Australia, UK, Germany, other stuff if you can see it, certificate in kinesiological taping from South Africa. Okay, so kitna hua? 4 countries. Then there is a fellowship in kinesiological taping UK also. So UK got covered, South Africa got covered, Germany got covered. So this instructor has done, see, I'm not doubting the certification. I'm just worried about the knowledge, which I'm going to show it in another 5 minutes. So there is Australia, UK, Germany and South Africa. Okay, so 4. तो कितना नॉलेज अच्छा होना चाहिए regarding the taping? Luckily, thanks to pandemic, that such kind of knowledge is now available on the YouTube, so that you can review people who is going to take the workshop. So I am like a middleman here, conveying this information to the students, because students, when they pass out undergraduates and from any kind of colleges, they are unaware about what knowledge they are going to get. Whenever in earlier days, when foreign instructor used to come in India, this was in year 2008, 9, 10, kinesiotaping used to happen in 2 days. So there are level 1, there are level 2, then you need to do give an exam of 100 marks, then once you pass with an 80% marks, then you become a CKTP. To maintain that CKTP, I need to pay every year to KTAI approximately 30-40,000 to maintain that credentials. Okay, there are many people out there who just do that 2 days course from a foreign instructor and started teaching to you guys. So understand, these people are still holding the basic certification. I'm again telling you, it's not about the certification, it's about the knowledge which you are going to get in this live session right now. After that CKTP, you need to go learn with the founder, stay there in UK, learn with the founder. They are going to send you slides which are legalized and authentic. Then you pass an exam, and that's how you become an instructor. Till now, I have done taping case 6 courses. I'll list you one down, because this person has just called me 30 minutes before to check my credentials. So this is a quick answer to him. My first certification of KT was from K Active Germany, from where he learned I never write in my poster Germany. Second, I did it from KTAI 1 level 2 with Abhya Gupta. Then I did functional taping with rock tape level 1 level 2 in UK, London. Then I did with Mueller Sports Medicine, United States. When the instructor like this are there to teach in merely 3,000, 4,000, you can KTAI fees, if any one of you in the above listed participants have done KTAI fees is 16,000. How an instructor in India can be produced when you have they are not even a competitors who are running a business with 4,000 and 5,000. How a authentic certification people will rush to 16 or 17,000 courses. This is all because of such individual taking the undue advantage of everything. So this is now a lecture where we are going to review it one by one. This instructor is taking workshops since 2012-13, whatever the number is, plus has a credential of 4 countries which I just listed: South Africa, Germany, UK. You can put anyone in the map. So the knowledge should be good. Okay, on that basis we are going to review. Thank you for joining. Just listen. I will teach you whatever is wrong over here, okay, with all clinical reasoning. Let's start.
If you have to learn it, why and how to learn it, okay? Now, as Mansi rightly said, what I will be covering here, so let me start off with this. First of all, guys, the question many people ask me is, when we think of taping, why is it important to learn? Why is it needed to learn, right? Clinically, is it feasible? Evidence kya hai is pe? Everything is there, guys. We have articles also published on this. Clinically, I mean, if you see the OPD cases, outpatient cases, works fantastic. Sports physiotherapy, you can't even imagine without taping today's times. So it's very, very important, okay? I remember my interest in taping started a decade or beyond that. I was finishing my master's. So I learned taping at that time. Since then, I've been applying it. And one thing that I have to always see in taping, which I try to educate in all our IMTT workshops, is, see, our first experience with tape generally comes, as a physio, in your OPD when you apply IFT electrode and you apply micropole tape on that. Yeah, so it lets it stay. So our first initial experience with tape. So what is that kind of a tape? That is a paper based tape which you apply on the skin, right? So taping, what is it? Can we use any tape? Which tape should we not use? Today I'll try to make you aware on that, guys. Since this is an online session, we are not going to get hands-on. So I'll not cover techniques or no hands-on conditions, applications, because that's not right to cover in a webinar or online session. Rather, what I can cover is, I can give you a good idea on the do's and don'ts, on some myths concerning taping, which many people have. So I'll try to clarify that. So that will try to give you a more objective idea and a perspective towards taping. First things first, what is a tape? See, a piece of paper or a piece of fabric which has an adhesive on it, which can stick on the body, is called tape. Next, the workshop which I take, even the title of this webinar.
You need to listen to this very, very, very carefully. This is the title of the workshop.
Therapeutic taping. Yeah, therapeutic taping, where does it come from? See, the word therapeutic, why I have used in the title since years now, 7-8 years, is because the word therapeutic itself means anything that has a healing or a positive effect on the body. This is by Oxford Dictionary.
So according to the Oxford Dictionary, anything which has a positive on healing process, that is therapeutic. Take a note of that.
Yeah. So if you use a tape for a healing purpose, for treatment purposes, as an adjunct to a therapy, or as a component of your therapy and treatment, it is therapeutic taping. So first you have to understand, all taping is not therapeutic. You might be confused, let me clarify. I'll give an example. There are certain tapes existing since earlier times in the market. They are there, some people practice. With all due respect to them, what happens is they might not have a very positive effect on the skin. Like they might cause skin reactions, irritability at times, might peel off the layer of the epidermis itself at times. So this kind of taping cannot be called therapeutic taping, guys.
So this instructor is talking about the Dinoplast. Okay. I just want you to go Google it. What's the clinical usage of Dinoplast is. Dinoplast has been used since ages by the orthopedic in surgical as well as sports condition. To really understand this elastic adhesive bandage, पहले तो इसने खुद ने पेशेंट्स के ऊपर लगाना चाहिए. You must have not done any work experience in sports. That's why you're not aware about this elastic adhesive bandage. I challenge you to ask any sports physio right from 2008 dealing with BCCI, with Olympic team. Ask them in earlier stages, have they used elastic adhesive bandages or no? At that time when none of the stuff was available, elastic adhesive bandage is to be the best. Ask any physical therapist who works in a sports background, not for the clinical OPD physical therapist. He is basically not aware about what is elastic adhesive taping, and according to his definition of therapeutic taping, this particular tape does not come under therapeutic taping. Listen.
So first step is that to understand what tape is therapeutic, what is not. Okay. Now if I ask you this, you might think it's a kiss lihaz se, in what context? Let me explain. The first thing in taping you have to understand, if you want to pursue it in a hands-on workshop in future, whatever it is, you have to understand the adhesive on the tape.
You need to understand before taping anyone कि उसका glue कैसा है. What sense does it make? If patient comes to you in your clinic, if player is there injured on the field, are you going to check the glue or the adhesive in the tape? That's not our job. That is the job of a manufacturer. You go to buy any jeans, you are not going to check how it is made or what fabric it is. You're going to just go with the brand name because you know a spiker is going to make a good quality jeans, not apna fashion street या linking road wala stuff. As simple. You are not going to go there and ask them about the quality really. He is insisting you guys to check the adhesive. I'll come to that later too.
As I told you, it's a fabric or a paper with adhesive on that. So adhesive, gum, glue, simple words. If that glue or adhesive is of good quality, it might probably not cause a skin reaction. So you can call that a therapeutic tape. If the adhesive is not of good quality, not good as such, but not good for the human skin, it might be good for other works, carpentry work के लिए सब.
Carpentry work. So if the glue is good, matlab therapeutic taping. If the glue is bad, matlab non-therapeutic taping. इस हिसाब से sellotape, the one which you wrap it for gifts and everything, or for sticking something, even that comes under a therapeutic taping. Why you are not teaching that then? So based on the glue, you are going to decide whether the tape is therapeutic or no. when the patient आया glue check किया हाँ भाई glue अच्छा है चलो therapeutic let's do. This needs to be corrected.
Some other technical works fine, but not for the human body. So it's not therapeutic tape.
Yeah, it's not.
Now you might think, so how do we know?
How do you
Let
know?
me explain.
Yeah. Listen carefully. I'm telling you, you need to be smart enough to understand this.
There are basically two kinds of adhesives. You might be thinking now taping webinar, I thought colors issue hoga, red color, blue colors. No. It's not only about the cool stuff. We have to know the basics first.
Yeah. It's a taping workshop. We need to know the basic first. We should not be interested about what glue is there inside. You know what's the first principle of kinesio tape? You are never supposed to touch the adhesive side of the tape. The more you touch the adhesive side of the tape, that much mechanical property of that tape is lost. Are you going to open the tape, then check the glue, and then decide, oh, it's going to have a positive effect or no? Okay, so that's therapeutic. Does that make any sense? This is how our Indian instructors are. Listen.
Okay. So first understand what a tape is made up of. Okay, it is a paper or a fabric, with gum on it, glue on it. So this adhesive or glue is of two types. One is called your latex adhesive.
Now this is the elastic adhesive bandage ka description. The Dinoplast which I was talking about, which he did not include under his therapeutic taping because he just modified it. Okay, based on his convenience and based on his knowledge, what he grasped from all the countries. This is the use of the Dinoplast. Can be used as a compression bandages for all orthopedic use and also as a pressure bandages in burns and skin graft. Read. You will get this. So this is not benefit for the patient. So this won't come under this won't come under therapeutic taping. As simple as that. When we started our career, you can ask anyone in Mumbai City FC, in Kabaddi player, ask any Kabaddi player, have they ever played any match without Dinoplast? Any Kabaddi player, forget about the recent season where the kinesio tapes are available, but go in the past in 2012 or 14, ask any player who has played any single match without a Dinoplast. Right from football to Olympics, the national athletes, everyone in their career has used Dinoplast bandages. And this person directly did not include. So you don't need to learn. See, now the things have changed. People have grown. Industry has grown. You have new tapes coming in the market. So you outdid that particular tape, educate client and ask them to use a good quality of tape. It's that simple as that. And you can easily see it's easily washable with the lukewarm water. It doesn't leave any strain if you know how to do it and when you should ask the patient when to remove it. you're not going to use Dinoplast for the whole of the match. It's just going to use for the prevention stuff. Okay, let's go to the next one. So I hope you're understanding.
जो रबर का पेड़ होता है, बचपन में कभी देखा होगा, रबर प्लांट. When you cut the leaf, white sap comes off. Fevicol types, white, thick, gooey, sticky. That's your latex adhesive, guys. किसी भी टेप को आप ओपन करके देखो, touch it. If it is
किसी भी टेप को आप ओपन करके देखो and touch it.
white, sticky and very very gooey. बहुत चिपचिप है, मोटा है, thick है. So that is your latex adhesive. Like your Fevicol. जो पुराने जमाने में स्पोर्ट्स साइंटिस्ट यूज्ड टू यूज, even now some of them use, वो कौन सा टेप आता है आपका, Elastoplast, Elastocrepe, crepe bandage की तरह, and it has gum that they apply when they remove skin पे there are white dots. Yeah, that is latex adhesive. Or if you have been posted in orthopedic wards, they apply a tape on sutures पे लगाते हैं. When they remove the tape from sutures, yeah, there are white dots remaining, residual white gum चिपका रहता है. Yeah, sometimes skin only comes off. So this white color, thick, sticky and gooey adhesive is the latex adhesive. This you have to understand is not very good for the human skin.
If orthopedic is using it, they are not using it on the human skin. They are doing it on a cadaver, right?
If you use this, ये pharmacy से Elastoplast ले लिया, patient पे apply कर दिया tennis elbow के लिए, when you remove, skin looks red and pink, ना? क्यों? Because the layer of epidermis has come off. Or sometimes the white dots are remain. That is, the adhesive has remained on the skin. That is because this latex adhesive is very very strong. It is too strong in fact, so when you apply on the skin, it peels off the skin at times and causes reactions, allergic reactions. Hence, this is not a therapeutic tape.
Samjha, this is not a therapeutic tape. Orthopedic using, stupid. Any other people using, stupid. All sports physical therapists, players, athletes using are all stupid. But the instructor telling you a basic stuff about this, for this he'll need to literally work in sports. Then he will understand. Without learning, without getting any experience in sports, neither in the national level or international level, you directly just criticize elastocrepe bandage or Dinoplast और बस खुल गए, बस हो गया. मैंने क्रिटिसाइज कर लिया, थेरेप्यूटिक टेपिंग में ये चीज नहीं आता है, खत्म. अरे यूज इट, apply it. Orthopedic are stupid that they know that this layer of the epidermis is going to come out. Are they dumb enough to stick it on the skin? So in your webinar you criticize orthopedic also. There I showed you it is used for the burns as a compression bandage. Does this make any sense? 2012, this knowledge is going on in India. And no one has the balls to speak on this. No council, no association, nothing. This is just half. Listen to the next step.
First step, guys. Okay, no high, simple stuff. Any tape which you touch, white है, बहुत thick है, sticky है, gooey है, latex adhesive है.
Any tape which you touch, जितना बार टच करोगे, चेक करोगे, गुई है, स्टिकी है, उतने में एडेसिव उसका चला जाएगा. फिर क्या घंटा लगाओगे टेप एंड पेशेंट्स के ऊपर? Who teaches like this that you are supposed to touch? See, are we a movement therapist or a rehabilitation therapist or are we glue therapist? Are you going to check the glue कि टेप में glue कितना है, क्या है? Simple logic, get a branded tape which has a good quality adhesive, लगाओ और खत्म. You are not going to, when patient comes into clinic, just check, oh ये गुई है, hypoallergic है. Did anyone taught you in 4 years of physical therapy to teach how to assess the glue?
If it is latex adhesive, बाकी चीजों के लिए यूज करो, human body पे नहीं, because it is not therapeutic. It is not, basically the substance is not hypoallergenic. You must have heard of this word, hypoallergenic. Hypoallergenic means any substance which has a less tendency, I cannot say कभी भी नहीं, but it has a less tendency of causing an allergic reaction. If somebody is very sensitive, it might still cause. We cannot.
बस यही स्टेटमेंट चाहिए था मेरे को. If the latex is sensitive, then it will cause. तो भाई, that is not a therapeutic taping according to your concept. If that tape is, you just spoke 30 minutes prior, that if that tape is giving any kind of allergic reaction, that is not going to be a therapeutic tape. So if you apply a tape and it causes any kind of allergic reaction, even mild, bro, that is not a therapeutic tape then. Understand, you're criticizing your own modified concept of therapeutic taping.
Not guarantee, but it has a less tendency of causing allergic reaction. And this latex adhesive is not hypoallergenic. That means there's a more tendency of causing an allergic reaction. So first step, any tape which has latex adhesive, do not use on the human body. With all due respect, I see many people using it. I'm trying to educate, make you aware.
He will educate. Listen, he is going to educate. A person who has not used a single tape in their entire life, he is going to educate we all.
Don't use it, guys, okay? That might cause allergic reaction, then the patient is not happy, and then they go to a dermat and complain. We don't want that. So let's clear basics. Because I see many BPT students, they see a television, कि सर डेल स्टेन ने ब्लैक टेप लगाया था, सानिया मिर्जा पिंक टेप, कलर्स आएगा, वो सब उसका टाइम है. बट फर्स्ट बेसिक्स, लेट्स नॉट जंप टुवर्ड्स द कूल स्टफ. यू हैव टू बी अवेयर, ओके, कि हाउ टू चेक अ गुड टेप. So two kinds of adhesives. Latex adhesive, I told you it's not good, non-hypoallergenic, not therapeutic. So do not use that tape for taping purposes. Yeah. The other kind of adhesive is your acrylic adhesive. Okay. Now I'll give an example. OPD में जब when you see micropore tape, paper ऊपर निकालते हो आप, when you touch that.
Micropore tape. I don't understand what is the obsession of this instructor with the micropore tape. I remember when I was in my third year in Naya, we first time there was Mulligan concept. Deepak Kumar has used it temporary. This is, I'm talking about 2009. After that, no physio ever have used micropore taping. माइक्रोपोर टेपिंग के बॉक्स के पीछे पहले देख लो कि उसका यूसेज क्या है. एंड ही इज टेलिंग यू टू चेक माइक्रोपोर टेप चिपका के. तो 2-3 बार माइक्रो टेप को ग्लू चेक करेगा, वो माइक्रो टेप का एडेसिव भी चला जाएगा. लिसन,
acrylic adhesive. Okay, now I'll give an example. OPD में जब when you see micropore tape, paper ऊपर निकालते हो आप, when you touch that, वो उतना white नहीं होता. It is more transparent. It's more transparent. It's more gentle, yeah. It's more softer, not that strong, not that overwhelming on the skin, yeah. So this transparent, gentle, not so sticky tape.
Have you ever checked micropore tape का glue? कभी ट्रांसपेरेंट देखा है जिंदगी में माइक्रोपोर टेप का?
Acrylic adhesive it is called. Okay, this acrylic adhesive is not naturally occurring substance. It is artificially synthesized, keeping the human skin in mind. Okay, so all the good tapes you get, be it kineso tape, rigid tape, athletic tape, अगर आप ओपन करके देखो, don't go by the brands. ये ब्रांड का अच्छा है, ब्रांड तो कोई भी, I can stick a brand my name.
See, I can stick a brand of my name. Bro, you cannot stick a brand of your name. People will sue you for that. Let me tell you, go and stick brand of your name. Entire company will come and sue you. His knowledge, he has done taping, so he should be in the first place to tell you which brand is good and which brand is not good. You buy in a car, you go to buy a car in a showroom, they tell you, okay, this brand is good, Tata Nano is good, Mercedes is good. You are the instructor. You need to tell students which brands are good, which brands are not good. 4 brands I will tell you which are good, okay, as lecture wise. Kinesiotex tape is the first brand original from Authentic. Rock tape is the second best brand. Mueller, this is the third best brand. There has been a research study done by foreign instructors on which brand is good, right, to grade it from economical brand to the one which sticks. Out of that they found this 4 brands right from the economical. I will give you the chronology also. First is Kinesiotex Gold, second is the Rock tape, third is a KT and a fourth is a Mueller. उसके बाद जो भी नॉन ब्रांडेड टेप है वो सारे चाइना के हैं. So if you are teaching to a student, it's your responsibility to tell them not to check the tape by its glue, definitely not, but you need to give them a brand so that they can choose what is good and what is not.
Doesn't matter. You should be in a position to evaluate.
Yeah, the brand doesn't matter. You should be in a place to evaluate the tape. So that's what I said. When the patient comes to you, don't forget the brand. You get any brand, 5-6 brand लो, उसका glue निकालो, check करो glue है, therapeutic है, नहीं है, उसके बाद decide करो. What logic? I need a question answer for this logic.
And check whether it's good or not. Yeah, brands, they all come from South Korea. Simple as that, sir.
See, he doesn't even know where the brand comes from. He said all come from South Korea. You did only one workshop. I'm telling you, इसने जो workshop किया है, मैंने भी वही workshop किया था 2009 में. तब वो कोरिया से भी नहीं आता था. It used to come from Japan. Nittodenko करके वो टेप का नाम था. Okay, whoever has been passed out in 2009-10, they have done it from the same workshop. Nittodenko was a brand. There are many. The Kinesiotex is manufactured in United States. Everywhere it's manufactured in US, UK. Rock tape is from United States, UK. उसका warehouse है फ्रांस में.
From Japan. So you should know how to check. If you open a tape, white है बहुत.
See, you open a tape, glue को touch करो. भाई पहला principle है Kinesio का. You are never supposed to touch the adhesive part. The more you touch the adhesive part, mechanical property of that particular tape is lost. तुम इतने बार ग्लू चेक करोगे तो उसका ग्लू बचेगा ही नहीं. What are you teaching in the 150 workshop he has taught? Every workshop 30 to 40 students come. You do your maths. See how many students gets fooled.
Sticky and gooey, not therapeutic, not good. Latex adhesive. If it is transparent, not very sticky and gentle to touch. Now it will be very light, उतना dense नहीं होता है वो. That is acrylic adhesive. Any tape that has acrylic adhesive is good for the skin, gentle for the skin, and usually, unless somebody is very sensitive, usually does not cause skin reactions. So using such tape is safer. First step in taping.
First step in taping is there is something concept which is called as a test patch. एक छोटा सा टुकड़ा लो टेप का, उसके अपने mastoid process पे रखो या inner side of the forearm पे रखो या inner side of the groin पे रखो. It's a more sensitive area. So when you apply the tape on that particular area and within 10-15 seconds if the part becomes red, that means they are allergic to that particular tape. This is how you're supposed to evaluate whether that tape would be effective or hypoallergenic on that particular patient or no, not by touching the glue. Definitely not by touching the glue. That's completely wrong and nonsensical stuff which is going on here.
Okay. Now you might think, sir, ये तो strong नहीं है, फिर skin पे रुकेगा नहीं? It will come off faster? No. Though the acrylic adhesive is not so strong, but it has a quality to it. When you apply acrylic adhesive and rub a little bit, activate the adhesive, it forms a bond with the skin over a period of time.
देखो, same contradiction. He just say paper-based tape. When you rub it, only Kinesio is a heat-activated tape. Your rigid tape is not a heat-activated tape. You don't have to rub your rigid tape over and over it again. Only Kinesio has that property of heat-activated tape. You use your rigid tape and everything. Do you rub against it? Never. It's all the glue which is there inside which is making it stay stronger.
Becomes stronger and actually lasts longer than the latex tape. Getting it, guys? So first step, how to identify. If the glue is acrylic, it is hypoallergenic. Tick. It is therapeutic. अगर latex है, non-hypoallergenic, non-therapeutic, not to be used like by a qualified movement scientist like you. Yeah, knowledge is power, right? When we know it, we know what to do.
Yeah, knowledge is power. How much knowledge I am getting today, and how much knowledge you guys are getting, all 41. This knowledge, when you apply, you are going to get superb results.
चलो, ये हो गया अपना first step.
First step done, guys.
This is clear, guys?
Yeah, very much.
Till now? Chalo. Fine. Now, next step. I'll try to cover few important points on its reproductive session.